Right now, Illinois Democratic Congressman Krishnamorthi. He serves on both the Oversight and Intelligence Committees. Congressman, good to see you. What is it like,
Frederica?
What is it like for you to see, your community rally around healthcare workers, to donate life-saving protective equipment, supplies, and how do you assess that along with the federal government's response? Do you feel like enough is being done from all corners?
Well, I think it's very good that people are rallying to donate extra supplies of personal protective equipment and similar gear. But unfortunately, the federal response and what we've seen coming from the White House specifically on this issue has been woefully inadequate. My wife is a physician, and she had to go and buy a welder's face mask because her hospital has run out of N95 masks. She had to buy personal goggles from another store because they've run out of eyewear. This is the type of thing where, the president invoking the Defense Production Act and getting manufacturers to produce this equipment 24/7 is absolutely essential now more than ever, because we can't allow these healthcare workers to get infected. They might spread the infection, and of course they could be out of commission to treat people who are sick right now.
Yeah, we've even heard in some cases people have used swim goggles, to try to protect themselves as well. The House Speaker, Nancy Pelosi, she did not mince words on the way that she sees the administration, particularly the president, handling matters. Listen to what she told our Jake Tapper earlier today.
Are you saying that his downplaying ultimately cost American lives?
Yes, I am. I'm saying that because when he made the other day, when he was signing the bill, he said, just think, 20 days ago, everything was great. No, everything wasn't great.
And what are your thoughts on what the House Speaker said and the fact that the White House is now, and the CDC is also talking about new restrictions, travel restrictions?
Well, I think if we've learned anything in this crisis, it's that two things. One, you have to let facts and science dictate decision-making and nothing else. And then second, you have to move quickly to stop the spread of the virus. And unfortunately, on too many occasions, the president has not used facts and science, but rather other considerations to dictate his response to the spread of the virus. And then he's also delayed testing. He's delayed social distancing requirements and so forth, which unfortunately allows the virus to spread and people get sick and they ultimately die.
Mm-hmm. And people are frustrated, and there are a number of criticisms that are being launched, whether it be directly at the president or the administration. But then how do you use that energy, or what are you hoping to advise to use that energy of frustration in which to promote some solutions in the near term and long?
Sure. Well, I think if there's any good news is that on Friday we did pass our Phase 3 stimulus in a bipartisan manner, and the president thankfully signed it into law, and it's going to rush a lot of assistance to state and local authorities to help with the current crisis, as well as rush assistance directly to small businesses and working families. Now we have to do, I think, the hard work of figuring out what's next. Because what's happened is, as some people have said, we've basically had the economy go into a medically induced coma to stop and kill the virus. Basically, we've brought economic activity almost to a standstill. But when the economy opens up again in, let's say, 8 weeks, 9 weeks, 10 weeks, whenever the virus is killed, we don't know that the economy is really going to bounce back to what it was pre-pandemic levels. And so that's why now we have to channel our energy into figuring out what's next. Mm-hmm. What do we do next to help working families, small businesses, and states and local authorities bounce back?
And what's the gauge or measuring stick in which you're using in which to determine when the economy should be reopened?
Again, I think facts and science have to determine our decision-making on this. Did we flatten the curve? Are the number of infections per day going down? Have we seen the number of deaths or the rate of people dying going down, all of the questions that I think scientists and public health experts are asking, we need to look to them to ask the question, okay, are we now getting better? Or are we in a different place? And that should dictate what our next step should be as far as opening up the economy.
All right, Congressman Raja Krishnamoorthi, good to see you. Thank you so much, and stay well.
Thank you.